Hi, my name is Jessica Nicole Husto, and I am going to talk about panic disorders. My group and I have chosen from what was given anxiety and panic in teens, and throughout this PowerPoint, we're going to be talking about the different types of anxiety disorders, what happens, why it occurs, what the DSM 5 has to say, and how this all ties back to positive psychology. And we're going to be talking about our intervention that we have chosen to use and how that ties back into positive psychology. So, before we get into the core of what panic disorders actually are, we're going to talk about what anxiety is in a general term. So, anxiety is a term for several disorders that usually tend to cause nervousness, fear, apprehension, and worry. These disorders usually affect how we feel and how we behave, and they can manifest themselves into real physical symptoms. People tend to have different types of anxiety. There's mild anxiety, there's severe anxiety. While mild anxiety is very vague and very unsettling, severe anxiety can be extremely debilitating just because it can cause a serious impact on day-to-day life. For instance, normal people often experience a general state of worry or fear before confronting something like a test or an examination, an interview, a recital, a concert. And these feelings are justified because they're normal. However, anxiety starts to become a problem when these symptoms start to interfere with the person's ability to sleep or to do day to day functions. So, generally speaking, anxiety tends to happen when a reaction is completely blown out of proportion with what might be normally expected in a certain situation. Anxiety disorders are classified into very more specific types, and the most common types are generalized anxiety, social anxiety, agoraphobia, and the one I'm going to be speaking about today, which is panic disorders. These disorders have all different characteristics, and their elements all make them unique, all their diagnosis elements. And like I was telling you guys before, these disorders are actually in the DSM 5, which is a Diagnostic and Statistical Manual of Mental Disorders, which is on its fifth edition. And each one of my peers are going to cover an important part of these specific disorders and how they relate to positive psychology, which is the topic that we're going to be talking about throughout the semester. And I will be focusing on panic disorders, as mentioned earlier. So the American Psychiatric Association, or the APA, they first recognized panic disorder as a mental health condition around 1980. It was then that the panic disorder was categorized into the DSM 5, or the Diagnostic and Statistical Manual of Mental Disorders, which is a handbook used by all of the mental health professionals to diagnose mental health conditions. To give you some facts on panic disorders, in any 1 year period, about 2 to 3% of people will have a panic disorder. Although anyone can develop panic disorders, rates are higher among family members of people with panic disorders already, or other anxiety disorders, which I've mentioned could be generalized anxiety or could be agoraphobia or any of the ones that I mentioned. Panic attacks may begin in childhood or in the early teen years, although panic disorder usually begins in late adolescence or early adulthood. So just to explain what a panic disorder is, because it's been very misdiagnosed and misinterpreted. A panic attack, which is what leads to a panic disorder, is a sudden episode of intense fear that triggers severe physical reactions, like I mentioned before, when there's no real danger or apparent cause. Panic attacks can be very scary, very frightening. When panic attacks occur, you might think you're losing control, you might think you're having a heart attack, and some people even might feel like they're dying. Many people have just 1 or 2 panic attacks in their lifetime, and the problem goes away, perhaps because a stressful event ended. But if people tend to have these recurrent, unexpected panic attacks, and they spend long periods in like that constant fear of having another attack, then that's when you might have the condition of panic disorder, which comes from having panic attacks, well, recurrent panic attacks. So the DSM-5 has a particular diagnosis for panic disorders. The DSM-5 describes panic disorder as an anxiety disorder, and it's based primarily on the occurrence of panic attacks, which I mentioned earlier, which are recurrent and often unexpected. The DSM-5 also says that the panic disorders, they must be associated with longer than 1 month of subsequent persistent worry about either one, having another attack or consequences of the attack, or two, significant maladaptive behavioral changes related to the attack. The attacks are not due to the direct physiological effects of a substance, which is like drug use or medication or general medical condition. And the attacks are not better accounted for by another mental disorder. So these may include a social phobia or another specific phobia, obsessive compulsive disorder, post-traumatic stress disorder, or separation anxiety disorder. Because the panic disorder diagnosis must rule out other potential causes for panic attacks, or else they won't diagnose it as a panic disorder. So according to the DSM-5, a panic attack can be characterized by 4 or more of the following symptoms. So it has to be 4 minimum or more. So it includes palpitations, the pounding of the heart or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, a feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, feelings of unreality or being detached from oneself, fear of losing control or going crazy, fear of dying, numbness or tingling sensations, and chills or hot fuses. So if someone, an individual, has 4 or more of these following symptoms for longer than 1 month recurrently by the DSM-5, they would be diagnosed with a panic disorder. When it comes to treatment for panic disorders, they're very similar to all the other anxiety disorders because the treatment helps each disorder in kind of the same way. For example, cognitive behavioral therapy is used in all of the anxiety disorders because it's generally viewed as the most effective form of treatment for panic attacks, for panic disorders, and for agoraphobia, and also for generalized anxiety or GAD. Cognitive behavioral therapy focus on the thinking patterns and the behaviors that are sustaining or triggering these panic attacks. It helps you look at your fears in a more realistic light. Also, there's something called exposure therapy, which is included in the CBT, cognitive behavioral therapy. And in exposure therapy for panic disorder, you tend to be exposed to the physical sensations of that panic that you would tend to have, but in a safe and controlled environment, which gives you the opportunity to learn healthier ways of coping with that panic. The counselor or therapist or whoever you're seeing, they may ask you to hyperventilate, to shake your head from side to side, and to hold your breath so that you can mimic, I guess, those panic attacks that you might have. And then in that moment, you learn how to cope with it. And then every time it gets a little easier and a little easier as you become exposed to that fear. And these different exercises, they cause sensations similar to the symptoms of your panic or of whoever's panic that you're feeling. So with each exposure, like I said, you become less afraid of these bodily sensations because they are internal. You might go to the doctor and they might see you're completely healthy, but since this is a panic disorder, it all comes from the mind. It's all mental. So with more exposure, you become less afraid of these internal sensations and you feel more control over your panic. Also, medications can be used to temporarily control or reduce some of these symptoms of panic disorder. However, they don't really treat or resolve the problem. They're just there to sustain a little bit, like all medications do for any type of disorder. It's no cure. My group and I decided for our intervention, to use art therapy for the relief of anxiety, of any type of anxiety. So for Panic disorders, and specifically, or even all the anxieties that we've been talking about throughout these videos, the research supports that art therapy has been very effective and it's used in the past as a treatment for panic disorders. It can be used to eliminate these negative emotions and focus on more of the positive emotions that you have. And then art therapy involves the use of art to promote health and wellness. So by a form of there's different types of forms of therapy. There's when we talked about exposure, we talked about cognitive behavioral. There's also talk therapy, but art therapy seems to have a big, big effective rate on the decrease of anxiety for in we're talking about for in panic disorders. Art therapy originated in the 1950s. For art therapy, the creative process is based on the belief that self expression can help you resolve your inner conflicts and problems. It helps you develop interpersonal skills, manage your behavior, lessen all your stress, and increase your self awareness so that the fears and other emotions that often accompany your panic disorder can be hard to express through the words alone. So that this creative process of art therapy can help you tap into those and and express those deep feelings that you're feeling once that panic is, is inside you and once that panic manifests itself. Art therapy is a very great intervention that we think is will be great for these teens to lessen their anxiety. We in our intervention we mentioned mandalas as our intervention and how mandalas can very, very, very much decrease all these anxiety and increase more of this positive emotion and positive thoughts within panic disorders. So as we continue throughout this presentation, people tend to forget that positive psychology, which is the topic of discussion, there's a link between that and mental health. So positive psychology is a focus on people's strengths, not just the symptoms or challenges. It's helping people with their mental disorders achieve a better quality of life and ultimately avoid being defined by their condition because a person is a person. It's an individual. You are you. Your disorder does not define who you are. So ultimately, positive psychology does share very strong connection with this clinical psychology and with overall with mental health, which includes disorders of anxiety that which we have been talking about. And this is because one of positive psychology's goals is to focus on what is right about a person and how these traits can be increased. The desired result is being a happier person with a more fulfilled life, which is similarly to clinical psychology because they are also trying to increase positive traits to help people deal with a mental disorder. So here, the end goal for both is to help people function in everyday life and lead a normal life. But they're not the same things. Their goals aren't identical, but they're remarkably similar. And as reported from people who have mental illnesses, positive psychology has also been linked to the prevention and aid in treatment of these mental disorders. So you can see that within the era of positive psychology, prevention could happen, which could happen with these teenagers who are experiencing these types of anxiety and having these panic attacks and feeling like overwhelmed with all of the anxiety that's thrown upon them. Positive psychology has research has shown that there's a link between that and and prevention and aid in these treatments of these mental disorders. So when it comes to these panic attacks and panic disorders, professional treatment and therapy can make a really big difference. But there are also things that you can do to help yourself or help a friend who is going through these panic attacks and may have a panic disorder. So there's things like learn more about panic and anxiety. Do your research. Avoid smoking, avoid alcohol, avoid caffeine. Those things affect your hormones and your mind and it's impaired. It impairs you. Learn how to control your breathing. Learn, practice relaxation techniques. Breathe in and breathe out. Breathe in and breathe out. Connect face to face with your family and your friends. Exercise regularly and get enough restful sleep so that these panic attacks will minimize on a day to day basis. Thank you for listening, and this was my spiel on panic disorders.